While there is increased incidence of pediatric cancers, constant mind-boggling question in the minds of the parents and family members. Is pediatric cancer genetic? Is it running in the family? Can we do any screening tests where we can identify the cancer-related genes at an early stage? Or is there a recommendation? So let us focus our discussion today on these topics. So the literature review and the studies have clearly shown that there is 10% incidence of pediatric cancers with cancer predisposition genes. So identifying the genetic pattern definitely may be helpful because it helps in identifying the risk population, early diagnosis, and identifying the treatment targeted strategies. So what are the common gene mutations which we can see? Most common being TP53 mutation, which is associated with Leigh-Fraumeni syndrome, causing increased risk of sarcomas, brain tumors, and leukemias. RB1 gene, that is retinoblastoma gene, hereditary type, where there can be increased incidence in both the eye tumors and also increased risk of bone tumors like osteosarcoma. Then there are few syndromes and children who have an increased risk of solid tumors and myeloid malignancies. So they are children with Down syndrome, then Beckwith-Wiedemann syndrome, where there is increased risk of liver and hepatic tumors, and BRCA1 and BRCA2 mutations. Though they are generally seen associated with adult breast cancers, the incidence and clustering of the cases can be done. Now, while we know that these are associated, do we need to screen all the children for these tests? Definitely the answer would be no. So how do we tailor it? It has to be a decision which has to be decided on based on multiple factors. Suppose there is a strong family history of cancers and other factors where there is a need for medical necessity, understanding the logistics, ethical issues, psychological support, cost effectiveness. They all play a key balanced role in understanding and further making a decision-based approach. Thank you.